Today I'm here to talk about a very serious healthcare issue. You and I know them as bed sores, but in healthcare they're referred to as a pressure injury. Pressure injuries can develop very quickly and can be very difficult to heal. I do have first-hand experience with both my parents and pressure injuries. As their healthcare advocate, had I known the signs to look for, they could have avoided this very painful issue. If your loved one cannot easily move themselves, please make sure to work with their healthcare team to have them move to alleviate any pressure on any part of the body so they can avoid these painful pressure injuries. As an advocate, do not be afraid to ask your healthcare team if they are seeing any signs of a pressure injury. And as a healthcare provider, please communicate any early detection to avoid further pressure injuries from developing. I give my time on the Pressure Injury Committee with Halton Healthcare because it's a very important issue to me.
Pressure injuries, otherwise known as bed sores, are wounds that form as a result of prolonged pressure to tissue, usually under a bony prominence, coming in contact with a surface, whether that surface be a bed or a chair. The issue is that prolonged pressure squeezes that tissue, diminishing blood flow, causing ischemic injuries. That tissue eventually is injured and dies and creates a significant wound. Wounds can actually be fairly minor, but they can be very serious as well, causing a lot of pain and discomfort. So individuals who are at risk for developing pressure injuries tend to be the very young and the very old. Pressure injuries are mostly preventable, and they do require a team approach to prevent them. That team absolutely includes our patients and their families as the center. Pressure injuries continue to be a significant burden to the healthcare system and to the patient across Canada. Our Canadian statistics show that over the last 5 years, hospital-acquired pressure injuries range between 8.9% and 11.2%.
As a physician, I have an important role to play in the assessment, management, and prevention of pressure injuries. As a multidisciplinary team, we take a holistic approach to patient care. During our regular rounds, we talk about things like skin integrity. Is the patient mobilizing? How is their nutrition? Are they adequately hydrated? These are the things that we know impact the condition of the skin. The prevention of pressure injuries is extremely important. It can take weeks to months to heal, and it can cause significant pain and even infection in patients. An ounce of prevention is worth a pound of cure.
The emergency department is the first stop in preventing pressure injuries. At first encounter, we look to identify patients at risk for developing pressure injuries.
Our patients who are at moderate to high risk of developing pressure injury are placed on the high-end air mattresses just like this one. Prevention strategies include minimizing the moisture over the patient's skin, assisting with the meals and providing them proper hydration, as well as minimizing the pressure over the bony prominences, as well as mobilizing our patient on a daily basis. If the patients are non-mobile or bedridden, we turn and reposition them every 2 hours.
Patients with compromised nutritional intake are at increased risk of pressure ulcers. As a dietitian, I like to ensure that patients are provided with well-balanced meals, which includes adequate energy, ample protein, vitamins and minerals such as vitamin C and zinc. Good nutrition is essential for good immune function and pressure injury prevention.
We educate our patients and their families on the importance of pressure injury prevention. We ask them to let their care team know if they have any redness or any pain, and we encourage mobilization and frequent repositioning.
As a physiotherapist, I encourage early mobility with my patients to improve blood flow and to get them up and moving. I also provide patients and their families with exercises and strategies to help prevent these type of injuries.
As an occupational therapist, I can be involved in making recommendations of products, both in the hospital and in the home, that can help to reduce the chances of a pressure injury developing. For example, I have here a heel boot that can help prevent a pressure injury on the heel, which is a common occurrence that can happen with people who've had an injury such as a broken hip or a stroke. This can help because it decreases the pressure over the back of the heel, which is a common area. We can also recommend products like custom wheelchairs, which this is a custom wheelchair designed for a particular person. And we can look at changing the tilt angle, for example, on this wheelchair so that the person can have a variety of positions and change the areas in which they have weight-bearing pressure. We can also recommend cushions. For example, this cushion has many air pockets, which helps to evenly distribute pressure over the bottom and decrease pressure over certain areas that are more vulnerable, such as the coccyx, which is the tailbone. As an occupational therapist, I will also make recommendations when we're looking forward to the patient going home. We'll work with our home and community care partners to make sure that the patient has everything that they need in the home to minimize the chances of a pressure injury occurring, such as hospital bed surfaces, which would be air surfaces, perhaps a padded commode, whatever that person needs in their home, we can help to make recommendations and make sure that an occupational therapist also follows up in the home to evaluate that equipment and its use in the home.
This campaign is a perfect example of why I became a patient family advisor, so that I can use my experience as a caregiver and an advocate to affect change. Please remember, it is easier to prevent pressure injuries than it is to treat them. Let's all work together to prevent pressure injuries.